Hey, this is Dr. Vong. I'm here with,
Dr. Walker.
and we are going to talk about. That cracks me up.
You're right, I know. It's like, Walker! We're having fun. We have more fun than we should be.
We're going to talk about rescuing patients who struggle after weight loss surgery. Cool?
It's a great topic.
All right. So, you went to this course at Harvard, and they talked about what to do for patients after weight loss surgery who might have a little bit of weight regain. What was their recommendation?
Okay, the Harvard folks were saying, be aggressive, docs.
Be aggressive. Be aggressive.
Do whatever it takes to get the weight off. And then they had several medical management strategies. And they like to go at it from two different angles for the meds.
Okay, so they recommend using meds. And by meds, you mean what?
So the most common meds that we use are the phentermine because everybody can afford that.
So diet pills?
Diet pills.
Diet pills. So you have phentermine. What else?
So they add Topamax to that.
Mm-hmm.
If you give that in a combination, one tablet, it's called Qsymia. We don't prescribe Qsymia because it's like $200. If we give you the generic components,
right?
yeah,
$2
a month. We can't even afford that.
I can't afford that.
So, and then there's other meds. There's injectable meds, Saxenda. This time next year, or actually it might even be this December, they're coming out with a once-a-week tablet for weight loss.
For Saxenda or for something else?
For it's a Novo that I can't discuss the name of it. Sorry.
Top secret stuff.
But it's coming.
So
it's
a new diet pill on the horizon. So basically, if someone's had weight loss surgery and they're plateaued or they're struggling or they're starting to regain weight, we recommend that they go see a bariatrician.
Correct.
Like yourself.
Yep.
And we call it medical rebooting.
Right.
And what do you do for my patients who get a medical reboot?
So what's interesting, I want to go back a little bit, is the people that have already had a bypass surgery or sleep, they actually respond better to these meds than if they haven't had it in the first place.
That's interesting. Is that based on a study?
So it was based on a random study, but they don't know the exact mechanism. But they get better results than somebody who hasn't had surgery before. So it has to do probably with GLP-1 and some of the neurotransmitters.
That's really interesting because I think a lot of patients watching this video will say, well, that's why I had weight loss surgery because I didn't want to take any more diet pills. What do you say to them?
Well, we don't want you to take diet pills either, but if we have to use them to get the weight off, we've had tremendous success in the patients that we put them on.
So for us, I'd like to tell patients, hey, it's a different train of thought. It's a different mindset. It's not forever. It's just to get you over the hump, get you back on track, whatever you need to do, get the train going to get your weight loss going. Would you agree with that?
Well, absolutely. And then our goal is to get you off of those meds altogether.
As soon as possible.
As soon as possible.
Yeah, so our clinic's very different. We like to have surgery and medicine work hand in hand, as opposed to some other programs you might hear about where the surgeons talk bad about diet pills and the bariatricians talk bad about surgery, saying surgery doesn't work and yada, yada, yada. And I don't think that's helpful, so we like to try to change that paradigm, right?
Absolutely, and we tell everybody that qualifies, you're better off having surgery than you are doing just the pills.
Yes.
The studies are out there, and we discuss that with patients that don't want to have surgery. We kind of nudge them to the surgery side because your long-term results are so much better if you do surgery.
And I tell patients that if you've had surgery and you're regaining weight, we need jump nets all hands on deck. We got to do whatever we can to stop that weight regain, get you back on the right way. And if that just means, temporarily going back on Optifast or seeing Dr. Walker or getting on diet pills, you really need to do it. Yeah?
Absolutely.
Comprehensive approach. Cool?
Very good.
Teamwork. See you next time.
We have fun.
Bye.